Wonderful, wonderful. Thank you so much for everybody for tuning in uh, for this great evening of education, information, and everything that's going on now in the community. So thank you everybody for tuning in. We're going to be sharing this right now in a couple of the groups. So if there's anyone have any comments, we'll be gladly to answer them in the section below. So give me 1 second. Sharing that right now to join the conversation. Perfect. Okay, so I shared it again. So thank you everybody for spending this evening with us. Special thanks to Anna with gifts from Liam. And then we also have a awesome, wonderful ladies who are going to be presenting as well. Again, my name is Eddie Ginn. I am an organizer, small business owner, and a community advocate here in the community of West Lawn. I've I just wanted to say again, thank you everybody for taking your time for making this happen. And so, kind of like the how this all started was this actually happened through an event here in the southwest side of Chicago, where it was collaboration between social change and other organizations, which included Gift from Liam, and that's where I met Anna. And just to see what she was doing, I was started seeing these prepackaged diapers with information, education, and I asked her about that. I was like, wow, this is amazing. I've never seen this. You usually see people just giving away, just either at the food pantry, there's newsletters, there's a lot of resources, but never have I seen this. And so I knew this was going to be something that the community needs because we're basically stuck where there's not enough resources in healthcare. And one of the things that we do need to have our neighbors is educated on all these priceless information. So I knew that this was going to be something that we could collaborate in the future. And so after numerous conversations after the events, we decided that it will be to partner up to do an event where we could be a diaper depot for Gifts for Liam to start collecting from the community, but as well distributing to families in need. And so, with that being said, my office is actually a partnership with Jacqueline Cervera with Farmers Insurance, and that's where I'm basically located. And upon speaking with her, because she has done many community events as well, so it's one of the things where I knew it was going to be a perfect fit for the community. Since she's been doing winter drives, these clothing drives as well as another other initiatives in the community. So I knew this was going to be a perfect fit. Speaking with her, because we had done many events during the summer, during the spring, especially during the pandemic, where we knew that these resources are going to be important for our neighbors. So with that being said, we started about a week ago. We started collecting on diapers, but then that's when we came across a great opportunity to collaborate with another small business, Westlawn. And we so she decided, which is Maria Valerio, she decided that for every diaper donation box or package, that anybody is going to be able to get a free toy, brand new toy for so this was going to be just I just knew it was going to be working, and something that's going to be great for the community. And once we started collecting, just an influx of diapers and just neighbors coming together. So it's great. And right now we're just about the 600. We had collected about just about 600 diapers, and so that's great. And but like I said, we're planning to be a permanent diaper depot, so we can start collecting and continuing to involve different events through the community. So that's very awesome news. And with that being said, I now want to introduce the presenters who will be delivering this vital information. All the presenters have lost children to stillbirth or SIDS, and their experience are what brought them to do this amazing work. So, with that being said, I want to introduce Anna, which is the founder of Gifts from Liam. Thank you, Anna.
Thank you, Eddie, for your wonderful introduction, and especially for this collaboration that we have now. We're going to do great work together, and it's so exciting for me to have our first diaper depot established. I'm not sure if folks got a chance to see this slide here showing the awesome sign you created for your diaper depot for the very first Gifts from Liam diaper depot. And that's awesome that you guys have actually collected 600 diapers now in such a short time frame. And I think between you and Jackie at Farmers Insurance, we're going to be able to get a lot more and help a lot more families. So as Eddie said, my name is Anna. I am the founder of Gifts from Liam, which I started in memory of my son, Liam. He died to stillbirth in 2016. I was 40 weeks pregnant when he died, which for those out there who aren't aware, 40 weeks is the full duration of a pregnancy. So he was stillborn on his due date. And that was after a very perfect textbook pregnancy. My background is actually in public health. And at the time I was working in perinatal care specifically. My job entailed a lot of reviewing of stillbirth and infant death statistics. So I knew statistically what the possibility of having a stillbirth was, but it's not something that I ever really envisioned myself having. I thought that I was perfectly positioned to have a healthy pregnancy outcome, but that just goes to show you that it can really happen to anyone. And I don't want to talk too much about my history and my background because the focus of today is on the educational component, but I'm more than happy to answer any questions that people may have about my background or Liam or my story or his story. What Gifts from Liam does is that we provide education to families and providers. And so we do that through a couple of different ways. Largely the education we provide to families is through our diaper packages, like Eddie mentioned. Each of our diaper packages does include educational information on safe pregnancy and safe sleep practices, as well as the risk of opioid use in pregnancy, and soon we'll include information on kit counting in pregnancy. And so a couple of my partners here from the Star Legacy Foundation, Lindsay Wimmer and Nancy from SIDS of Illinois, are on the presentation today, who will be talking to you more about those safe pregnancy and safe sleep practices to keep your babies healthy and safe during pregnancy and beyond, the topic of our presentation today. So I won't get too much into that information. We also provide education to providers. We provide education on current practices. A lot of providers actually are giving moms and families outdated information. And that was my situation with Liam. When I called to report that I had decreased fetal movement, using technical terms because of my background, they told me and instructed me that that was normal. The babies run out of room at the end of pregnancy, and that's not true. And I won't get too much into that because I'm sure that Lindsay will cover that. But I educate providers through presentations, through talks, through conferences, on making sure they're not saying the wrong things to parents, but also provide education on the aspects of providing compassionate care for families who have had a loss, because there's a lot of trauma around that, and a lot of the wrong things are said, and it's understandable because they don't receive a lot of training in that aspect. It's for doctors, it's maybe one session in medical school. So a lot of insensitivity happens around pregnancy loss. And so we work to educate providers on that aspect as well. Another thing we do is support bereaved mothers and families, and in part that is through the Star Legacy Foundation. I am a peer mentor, and I provide support a lot to Spanish-speaking families, as well as other families. And then just in general, through word of mouth and through referrals, people who expressed to me, oh, I know so and so who had a loss, can they talk to you? Yes, absolutely. I'm more than happy to share my story and provide support to any mom or any family member who's going through this devastating and heartbreaking experience. And then also through my Gifts from Liam page on social media, or even my personal page, a lot of the information and my story that I've shared, many people have reached out saying how helpful that is and how encouraging and supportive it was for them. And even if at the time of reading it, it didn't impact them, maybe they experienced a loss later on, and then they reached out to me to say, I'm really glad that you shared your story, because that encouraged me to share my story. And that brings me to my next point about what we do is raise awareness about pregnancy and infant loss, because it's a very taboo subject, and it's not going to become any less taboo until we talk about it more and we normalize it. And we do that through sharing our stories. So I really advocate for everyone sharing their story. And I'm very happy and glad and proud to be a source of support to other moms and families going through this experience, whether it's pregnancy or infant loss. There's kind of a shared experience there, even though there are very unique differences in each situation. And everything we do is for the ultimate goal of preventing any more pregnancy losses, baby deaths, infant losses, call it what you would like. But in this day and age, there shouldn't be as many babies dying as there are. And we will get more into statistics later on. And there have not been a lot of advances in that regard for the last 50 plus years, which is astounding, with all the other things we can do in medicine. But also preventing, not just preventing baby loss, but also preventing families, moms, caregivers from going through traumatic experiences around the care they receive, in particular in a medical setting. We should be training our medical providers, nurses, doctors, whoever it may be, even the ultrasound techs, from creating additional trauma for families who are going through the experience of losing a baby. So Gifts from Liam has a number of different angles, right? But the education that we provide, I mentioned, is largely through our diaper packages. So I actually have a diaper package here to show you what it looks like. So we bundle them each into 25 diapers. We put our label on it and the size, and then the label reads, helping to close the diaper gap while raising awareness for stillbirth, miscarriage, and infant loss in memory of the babies gone too soon. And then in the diaper package, you can see on here, this is a postcard from SIDS of Illinois with information on SIDS and safe sleep practices. And then also contained in this package is information from the Star Legacy Foundation, as well as information from the Illinois Department of Public Health on opioid use in pregnancy. And then also from the SIDS Foundation of Illinois is information on tummy time. It might seem kind of random that we're doing diapers when my experience was having a stillbirth. But when Liam's first birthday came around, I wanted to do something in his memory, and I learned about the diaper gap and diaper need. And it's not something that I had ever known about before, because fortunately for me and my family and what was going to be my child, I was in a position where that was not something that I had to worry about. The thought of not having enough diapers for my baby never crossed my mind. But on his first birthday, it fell during what is called Diaper Need Awareness Week. And so diaper need, or the diaper gap, refers to the fact that many families don't have the ability to provide enough diapers for their babies. 1 in 3 families, in fact, in the United States, can't afford enough diapers for their babies. Diapers are just as essential as many other basic things we use on a daily basis. Food, milk, feminine hygiene supplies. They're things we can't go without when we have babies. yet there are no public assistance programs that are providing diapers for families. Families may be receiving WIC, the Women and Infant and Children's Assistance Program. They may have food stamps, they may have rental assistance, or any number of other public assistance programs that they're enrolled in, but none of these programs are helping them provide diapers for their babies. And diapers cost a lot of money. Daycare centers require, many daycare centers require at least a week of diapers up front for your baby to be able to go to daycare. So if you don't have the funds to buy those diapers, well, then you can't have your baby in daycare. So that means you have to stay home. So then you're not making money because you have to stay home because you don't have diapers. And it's just a vicious cycle of poverty, like many other instances, and other poverty cycles that many people experience. Some people say, okay, well, what about cloth diapering then? Well, that's a great idea and it's really awesome for the environment and all, but cloth diapering is often not an option for these families because we're talking about largely, low income families who maybe live in an apartment or some other environment where they don't have access to a washer and dryer. Well, if you don't have access to a washer and dryer, how are you going to wash those cloth diapers? Take them to a laundromat. Many laundromats don't allow you to wash cloth diapers. Not to mention the fact that if you're cloth diapering, it's because you have a baby. And so then you're having to take your baby and the cloth diapers to the laundromat to wash them. So it's just realistically not an option for many of the families who find themselves in the diaper gap. And then buying in bulk. That's the way that you can get the most affordable diapers. You can do your Amazon delivery or your bulk delivery from any number of stores. But the problem is that the upfront cost of those bulk diapers is very high. It comes out to being less money per diaper, but maybe a family has $5 to $10 to buy a tiny pack at the corner store, but they don't have 20, 30, 40, 50, $60 to buy the larger bulk packages. And the larger a baby gets, the more expensive the diapers become. And then also, many families are given baby showers when they're expecting. And so they often get diapers through those baby showers, but most of the time the diapers they're getting are newborn or size 1. So that's great. They have plenty of newborns and size 1s if they're lucky. But then as their baby gets older, they don't get those gifts. So there are diaper banks and organizations like Gifts from Liam who will supply those diapers for families. But there's even a sense of shame and discomfort and embarrassment in having to ask for those. So the way Gifts from Liam operates is that rather than having families request from us on an individual basis and have to make that request of, hey, I need diapers for my baby. I'm almost out or I'm out. Can you please help me? What we do is through collaborations with other community organizations, is we will do a bulk delivery, 1,000 plus diapers at a time of various sizes, to be able to have those community organizations that are already serving families in need distribute those diapers to their families that they're already providing services for. So that's what we found to be most effective in delivering diapers. And so some of the organizations that we have worked with thus far in providing diapers are Respond Now, Advocate Trinity Hospital, Aid for Women, Social Change, Midwest Pros, Aunt Martha's, just to name a few. There are a few more out there. And I very much appreciate the collaborations with them. To circle back to the daycare aspect, we do bundle our diapers in packages of 25 because that's usually the requirement for most daycare centers. So we're not there to supply a baby with, to give a lifetime supply of diapers for any individual baby. We're there to help meet an urgent need for diapers. So, we might get you through the next week or the next couple weeks with supplying, one bundle. Although it is up to each organization's discretion whether they want to give one package or 2 or 20, that's up to them. We just supply them with the diapers and then they distribute them as they best see fit. But they're bundled into packages of 25 because of the daycare aspect of that's what most daycares require for a week. So those families don't have to have that stress and burden on them on top of everything else, especially in this climate with the pandemic of having to figure out where their next diaper is coming from. And they can focus on what's really important, which is being parents and loving their babies and taking care of their babies. And you know, they're already worrying about enough other things that we just want to alleviate that burden and close that diaper gap a little bit. And to date, we've donated over 65,000 diapers. Every single one of those diapers has been donated to our organizations through diaper drives that we've hosted and through families and friends who want to give to my initiative and who also want to support me in memory of Liam. Um, the need is ongoing, and especially with the pandemic, there's been an increased demand for diapers. So we are constantly collecting, constantly receiving. Any donations are always welcome. And then, of course, in addition to diapers, we're also donating wipes and diaper creams and powders and other, you know, related baby hygiene supplies. Moving on to the educational component of this presentation, I will be talking to you about best diapering practices, and then we'll move into the safe pregnancy and safe sleep practices with our other partners on the presentation. But some people may be wondering, like, why are you talking about safe diapering practices or best diapering practices? Like, that's such a simple, basic thing. And while that may be true and maybe natural for many people out there, maybe there are, you know, some people who have been diapering babies their lifetime through diapering their, you know, younger siblings or nieces or nephews or whoever it may be. Many people out there are also brand new to diapering, and it's not a skill that just comes naturally to most people. And there are right and wrong ways of diapering. And so I just want to give you a little bit of information on diapering practices to help you prepare for your baby that's on the way, or if you have a new baby, or maybe if your baby's even a few months old, maybe you're going to get a little bit of information that you weren't aware of. And actually, just out of curiosity, I Googled best diapering practices and how to change a baby diaper. And these are common searches. And then I posted on the slide here that you can see other relevant questions that people are asking Google, where we turn to now all the time. So I think that, you know, diapering practices isn't something that you would get in your wellness visits with your pediatrician. So I think that sessions like this are very helpful, as well as talking about the, you know, safe sleep practices and safe pregnancy practices, because those aren't things that are talked about in your doctor visits, but very essential, crucial information to keep our babies healthy and safe. So when it comes to diapering, there are some essential supplies you're going to need beforehand. So this is talking about the setup of diapering. Your supplies, diapers and wipes, I put in bold. Like, those are the two main things you'll need. Everything else is kind of a bonus and will make your life easier. But essentially, you need diapers and wipes. It's also super helpful to have some cream and ointment on hand, just in case baby gets, you know, irritation, a rash, some powder to help keep them dry, trash bags, like just some grocery bags to put diapers in after you're done changing. Changing pad is helpful. And then there are these things out there called pee-pee teepees, which cover little boys' penises so that you don't get sprayed. But also just any kind of cloth, rag, towel will do to cover your little boy for changing him. But it's also not essential, you know, to have that. And if you're super quick, it's not something you need to worry about. And then also some cleaning supplies on hand, just some kind of spray, bleach water, or vinegar water, whatever you choose to kind of clean up with after you're done diaper changing, just to keep the area sanitary. And then designating a location is also not something that's essential, and you're not always going to be able to go to that location. But if you have one designated place where you're living, where you're going to change your baby, that makes your life easier, because you know that all your supplies are already there, ready to go, and you'll, you know, just make sure you're maintaining that supply regularly, and you're noticing when things are low, you need to replenish them. But also, as baby grows, they will connect the dots and they'll know like, oh, we go here to this place to change diaper. And so that might make it easier because babies can get really wild and crazy and fussy and stuff when it comes to diaper changing. So if they can associate a particular location with diaper changing, that might just make the whole process a little bit easier, both for whoever the changer is as well as for baby. Um, but again, like most of these things aren't essential, just some helpful tips for you. Um, when it comes to actual changing. Best practice is to wash your hands before, because part of best diapering practices is, ensuring that you're keeping your baby free from any kind of, exposure to germs, bacteria, leading to infections and things like that. So wash your hands beforehand. As far as diaper sizes, every diaper package you'll ever find or that I've ever come across, and that's coming from someone who's received thousands and thousands of diaper donations and donated them, right? Like they have weights on the packages. So you will probably know what your baby's weight is. If you're going to your wellness visits, they weigh your baby every time, or at least you'll have a rough idea. Look at the weights on packages. That tells you what size diaper you need. When you're actually changing the diaper, girls should always be wiped front to back. The reason for that is to prevent infection. And then for boys, if they're uncircumcised, make sure you're not retracting the foreskin on the boy. And so using my finger just to clean the penis, you would just be using the wipe and wiping it this way. But pretending there's foreskin on the tip of my finger, you should never be pulling that back. Ever for their whole life. The only person who should be pulling foreskin back is the person themselves. And then as far as frequency, that's a very common question. How often do I change my baby's diaper? Well, diapers, many diapers now come with a wetness indicator on them. I don't know if you can see it here. Oh yeah, I think you can. Like you see this yellow line here. When it's wet, it turns blue. And the wetter it becomes, the more blue you see. So that's super helpful in knowing when to change your baby's diaper. But you also don't need to change a baby's diaper the second it becomes wet. So a general rule of thumb is every 2 to 3 hours when babies are newborns and for the first couple of months. As babies get older, they have a larger bladder, they can hold urine for longer periods of time, they won't be wet as frequently, and you can kind of decrease those diaper changes. You will have to kind of gauge that on your own. But the most important point is that you don't want to leave your baby in a wet or soiled diaper for very extended periods of time, because that can lead to irritation, something from a minor rash all the way to a very severe infection that requires medical attention and medication, and that makes baby uncomfortable, and that stresses parents out when babies are uncomfortable, on top of the added stress of where do diapers come, and then you just get into this vicious cycle again. And then as far as at nighttime, many people ask, well, if my baby gets wet at night, do I have to wake them up to change them? No, you don't. No, let baby sleep. Let baby sleep so you can sleep too. Of course, if babies do have a bowel movement during the night, change that as soon as possible. Same thing during the day. If babies have a bowel movement, change as soon as possible. But don't be too hard on yourself if you don't notice, or if you're asleep and then a little bit of time goes by before you're able to change baby. But yeah, general rule of thumb for urine, just wet diapers every 2 to 3 hours as newborns, less so as they become older, and change baby as soon as possible if they do have a bowel movement. After you're done changing diaper, again, wash your hands. Also wash babies' hands, like wipe them off with a wipe. They will often stick their hands in there. They might get BM on their hands, or even just the urine, or just from touching themselves. So wash your hands, wipe baby's hands down, and then give the whole area a wipe down, whether you're just using a changing pad or if you have your designated area with a changing table, wipe it all down if you can. Again, these are best practices, and in reality, your own process is going to vary, but best practices. Sorry, that's the slide you were supposed to be seeing. And then, of course, dispose of diaper properly. The tabs you can stick back onto the diaper and have it all wrapped up nice and neat, and then put trash in its place. Should go in a diaper, and I'm sorry, in a garbage can. You know, please don't be one of those people throwing diapers on the side of the road. And that is all I have for you. And as I expected, I did talk way more than I needed to, but hopefully that's some help for information for everyone. And now I will pass the presentation on to my wonderful partner and friend, Lindsay, who is from the Star Legacy Foundation, and she will tell you more about her organization and safe pregnancy practices.
Okay, Anna, thank you so much. Can you hear me okay?
Yes.
Okay, beautiful. So I thank you for having me on tonight. And you really kind of gave me a perfect introduction with so much of your story about Liam. And hopefully this will just kind of help reinforce some of those concepts that you already touched on. So just real briefly, as you already mentioned, my first son, Garrett, was stillborn in 2004, and this was my introduction to stillbirth as well. I'm a pediatric nurse practitioner, but yet I was completely unprepared and not expecting something like this to happen to us at 38 weeks into our pregnancy for what had otherwise been a normal and healthy pregnancy. In addition to all the, certainly the grief and elements that we encountered then, I was fortunate to go on to have 3 additional living children who you can see are alive and doing very well. But those pregnancies really did reinforce to me some of the differences between what I thought I knew about pregnancy and what I've learned from Garrett and then from these other pregnancies. And then also that there's many opportunities that we have to improve prevention of stillbirth and hopefully really bring some of those rates down, because I won't go into those stories now, but each of these 3 had their own issues that could have ended very poorly. But I'm so grateful and fortunate that because of some of the things that we're going to talk about today, they are here and in the light of my life. So I just want to share a little bit about what I've learned from them. So quickly, a quick overview of stillbirth in the United States. This is data from 2017, which up until just a couple of weeks ago was the most recent that is available from the CDC. We're currently in the process of creating the 2018 scorecards from that data now. But looking at 2017, not a lot has changed in the last 3 years, so it's still a fairly accurate picture. You can see that the stillbirth rate is 5.9 per 1,000 births. And that really has not changed much over the last 10 years and even further beyond that. That equates to about 1 in every 160 deliveries in the United States and nearly 23,000 babies throughout the United States. When I look at Illinois specifically, the stillbirth rate in Illinois is about 6.1, so slightly above that national average. You'll also see that we have marked there at 5.6 was actually the Healthy People 2020 goal that was established for fetal deaths, which is kind of the more technical term for stillbirth. And so while many states are kind of really trying to make good progress in that, in general, as a nation, we have not gotten that low yet. You can see that Illinois has some really good numbers just below that for a little bit, but have had some bumps back up again more recently. So that is something that across the country we still have to do a much better job of. In 2017, the state of Illinois experienced 911 stillbirths. And so that, when they started equating that to the actual families that are impacted every single day, that is just heartbreaking and something that we're working really hard to try to fix. If you want to look more into this data or look out some of the other states that, if you have connections or for anyone who's looking at this from outside of Illinois, all of the individual state scorecards can be found on the Star Legacy Foundation website. A couple of other quick things. As I mentioned, the rate has been pretty static for quite a while. We also see that when we break down into maternal age groups, there are some that have a significantly higher rate. Most notably, we are seeing an increase in women who are having pregnancies later in life. And you can see at 35 years is technically the cutoff for what we call, sometimes you'll hear the term geriatric pregnancy or advanced maternal age. And one of the reasons why that is a concern in terms of stillbirth is that we see how the rate increases so dramatically as the mom's age increases, so that those over 45 have a stillbirth rate of actually 14.0 per 1,000 births, which is more than double the average for the nation. So certainly something that these older moms need to be aware of and need to really be paying attention to. We also see significant racial and ethnic disparities. Black women in the United States typically have a stillbirth rate double that of white women. Native Americans also have a much higher rate, and this is pretty consistent in every state across the country. When we're looking at causes of stillbirth, this data is actually from the Stillbirth Collaborative Research Network, and this is really a robust study, but one of the unique components of it is that every single family enrolled had a full evaluation of their loss done. And that in itself is a very unusual thing. So you will see that one of the biggest chunk of causes of stillbirth is unknown. And that's really scary because in this particular study, it was less than in most studies, because that evaluation and investigation was such a common thing. In reality, only about 30% of all stillbirths are evaluated with a full spectrum of testing on mom and baby. And so we actually see closer to about half of all stillbirths have no idea what happened. And that, of course, just adds another layer of devastation and heartbreak to families. Of those that we do know what has occurred, placental concerns or issues, obstetric complications such as issues with labor and delivery, or maternal health conditions like preeclampsia, gestational diabetes, etc., and umbilical cord issues are the top causes, followed by infections and then genetic conditions. Because we don't have a perfect kind of smoking gun, if you will, on what is causing so many of these deaths, we tend to look at the risk factors to try to identify who is at a greater risk and how can we try to mitigate some of these risk factors, and then downstream from that reduce the rate of stillbirth. When we look at social determinants, like so many elements of healthcare, but particularly all forms of maternal child care, social determinants are a significant factor. Those who are from low-income families and communities have poor access to care for any number of reasons, have been subjected to racism and have historical trauma from racist activities. Those who have not attained as much education, have little or no preconception or prenatal care, and those who are in stressful or traumatic situations or have histories of those scenarios have all been found to have significantly higher rates of pregnancy loss in general and stillbirth specifically. When we look at maternal health, as I mentioned, gestational diabetes and preeclampsia are two very well-known risk factors. Autoimmune disorders, of course, maternal substance use gets mentioned quite a bit. Also, maternal obesity, maternal age, the extremes, as I mentioned on that previous slide. Primiparity refers to the fact that it is a woman's first pregnancy. And this is a very interesting one that a lot of people don't think about, but a lot of it is because she hasn't had a previous pregnancy for us to really know how her body might respond to pregnancy. And she also doesn't have that experience to compare and really know when things are normal or not. But so we need to make sure that we're doing an extra good job of really educating women who are in their first pregnancy. And then those who have had a previous loss or a previous poor outcome before are also at greater risk. And then finally, when we look at some of the characteristics of the baby themselves or the pregnancy, We know that pregnancies that use IVF or other assisted reproductive modalities have a higher rate for stillbirth. Multiple gestation, meaning twins, triplets, or even higher gestations. Any change in fetal movement, we're going to talk about this a lot. Fetal growth restriction, that's when the baby is not growing as much as it is supposed to. When that is identified, that is a very, very significant risk factor that needs to be taken very seriously and really needs to be monitored closely. And then the presence of any placental or umbilical cord abnormalities that may be identified on ultrasound. So, well, I want to just kind of talk a little bit about how we use information and knowledge of those risk factors to try to improve the outcomes and improve the health and safety for both mom and baby. These are a few of the materials that Star Legacy Foundation provides and that Anna and Gifts for Liam include in their diaper packages. So we'll just go over a little bit of the content in more detail. So I mentioned baby's movements. This is one of the best things that moms can do to help us monitor how well their baby is doing. The baby's movement is basically kind of their communication tool with us. And so there's certainly so many benefits, not the least of which is that it's an opportunity to really bond with the baby, get to know this baby's personality, and really kind of enjoy that part of the pregnancy. But there's some health benefits too. I always like to tell moms that you are the best monitor that we have. We can use all kinds of fancy tools when you're in the hospital or in the clinic, but those aren't 24/7. You are 24/7, and you know your body and you know your baby better than anybody. And so we really want you to trust that and to know that there is significant value in what you know and feel and believe about this pregnancy. One of the best things you can do is get to know what's normal for this baby. Every baby is going to be a little bit different. Anybody who's been pregnant more than once will tell you that some babies are really chill and just kind of constantly are pretty low key. Some babies are constantly super, super busy, and maybe you may be able to figure out that this baby really gets crazy after, I listen to certain types of music, or maybe this baby gets really crazy after I eat certain kinds of foods. The biggest thing is to kind of just get to know your baby and what is their personality and who are they. It's important to notice the patterns, and this includes the frequency, but the strength, the characteristics. So when we talk about monitoring movement, we don't want to just count and look at a specific number. We want to say, what do we know about that? How would you describe those movements? Are they really strong? Are they frantic? Are they smooth? Are they flutters? Some of the different words that moms will use, and throughout the day that may change, but knowing when your baby tends to have what types of movements and what's normal for them really is an important part of understanding this part of your baby's communication with you. And above all else, the biggest thing that I want to reinforce is that any mom who feels that she is noticing any change in her baby's movement, and that can include change in the frequency, change in the pattern, change in the strength, change in the characteristics, report those changes immediately. So many times we hear moms say, I have an appointment tomorrow, I'll just ask them then. Or I called my friend who said, that happened to her, so I'm not going to worry about it. You're the best monitor that we have, and you're the one who is knowing this baby and is with this baby the most. If you feel like it's a change that you are noticing, we want you to report that immediately. It very well be completely normal, and that's fantastic. But we want to take the opportunity to make sure that is the case and to reassure you as well. Most babies have established a pattern by about 24 weeks into the pregnancy. So that's the time when we really want to start making sure that moms, kind of have the words and really have been empowered to know what is their baby's behavior. Anna kind of hit on these, but two big myths that I want to hit on. First is that babies do not slow down at the end of the pregnancy. We hear this very, very frequently, and it actually has been disproven by many studies. Babies do not slow down at the end of the pregnancy. They don't settle down to get ready for delivery. They don't run out of room. So if you are noticing your baby's movements being less, especially at the end of the pregnancy, we need to know about it. And please report that to your provider immediately. And the second thing is there is no benefit in trying to wake your baby up. If you're noticing this decrease in movement or any change in movement, a lot of times people will recommend waking the baby up with a sugary drink or cold beverages, caffeine, those kinds of things. And first of all, they've been proven not to really work. But secondly, if your baby is needing caffeine in order to have their normal level of activity, that's a concern in itself. And so we definitely want you to see your provider and make sure that everything is okay and not waste time trying to do some of these extra things. I have a quick video here that was put out by Tommy's, which is a charity in the United Kingdom, just talking about monitoring babies' movements. One of the most common questions we get from moms is, well, how will I know? What if I miss that the movement has changed? And we really want to make sure that moms know that they actually know more about their baby and their baby's movements than they realize, even if they haven't done very formal analysis of that. Hopefully it will cooperate here. Oh, well, I won't waste time trying to fix IT errors because that is definitely not my strength. But it is easy to find on the Star Legacy website or also on YouTube as well. All right, the next thing we want moms to do as part of safer pregnancies is to adopt that healthy lifestyle. These are things that are good for all of us, whether we're pregnant or not, but definitely a pregnancy can be a great time to do this and do it as a family. It doesn't hurt everybody in the household to be thinking about getting good balanced nutrition, getting regular exercise, reducing or eliminating any use of drugs and alcohol, and that can be prescription or non-prescription drugs. So this make it a family event. It doesn't have to be a chore that's only mom's responsibility. This can be something that we're all going to say, you know what, we're going to bring this baby into as healthy an environment as we possibly can, and let's all do this together. And it's going to help mom be healthier, help baby be healthier, and hopefully can even establish and reinforce some great habits that you will want to continue as your baby gets older as well. And we want to make sure that we're following the recommended prenatal care schedule as much as possible. Obviously, in many cases, access to care is a major concern, and so we want to do everything we can to address those. COVID has also created a lot of barriers because those care visits may have been changed to virtual visits or may have been canceled altogether. We also know many moms have been nervous about going into the healthcare facilities because of the pandemic. So we want to really make sure the baby is getting all the tests and all the care that is recommended, because those schedules are put in place for a very good reason. And we want to make sure that we follow that as much as possible. Quality sleep is another piece of the healthy lifestyle that sometimes gets overlooked. A lot of times just in our society in general, we think of sleep as this nice little bonus that is good once in a while if you can get it, but it really is vital to our health and our mental health in every aspect of our being. And this is true during pregnancy as well. So we really want to focus on quality sleep for moms. One thing that we're learning so much more about right now is mom's sleep position, particularly in the third trimester, as the baby in the uterus gets significantly larger and puts more and more weight on mom's abdomen and pelvis. It really can shift a lot of the blood flow that we see returning to mom's heart, but then also being able to pass through the placenta and the umbilical cord to the baby. So in that third trimester, we really want moms to go to sleep on their side. It doesn't matter which side, they can switch through the night. We just want them to not be laying flat on their back. because that is where that baby in the belly has the most compression occurring on the blood flow. It's okay if mom wakes up and realizes that she has rolled onto her back, because we actually have studies now showing that whatever position mom goes to sleep in is where she spends the most of her night of sleep. And a lot of times it's possible that just the action of moving onto your back is what woke you up. So if that happens, it's fine to just roll back onto your side and go back to sleep, especially if your baby's behavior and other things are all normal at that time as well. We're also learning a lot more about snoring, especially really significant snoring or significantly worse than it was before you were pregnant. Sleep apnea, restless leg syndrome, any kind of concerns that are interfering with your sleep or interfering with the quality of your sleep can be very problematic. There's actually a lot of connections now between sleep problems like sleep apnea and hypertension, which can lead to preeclampsia and many other health concerns for both mom and baby. So sleep is not just something that's a nice little pampering thing for yourself. It really is vital. And if you're not sleeping well, you don't feel rested, and you or your partner is noticing some of these other sleep behaviors that could be problematic, please bring them to the attention of your provider and make sure everything is evaluated as thoroughly as possible. There's another video from Tommy's talking about mom's sleep. I don't know if that one's going to work or not if I continue to have issues, but again, this one can be found on the Star Legacy Foundation website also, or on YouTube. So just some final things. So many times there's confusion, and moms don't want to be that patient that is constantly bugging their doctor or their midwife. When do we absolutely want you to make sure that you call or go straight to the hospital to be evaluated? Anytime you as the mom has a fever, are experiencing bleeding, any new, changed, or worse pain, headaches, fainting, dizziness, painful urination, if you're vomiting more than once a day, experiencing sudden or significant swelling, constant itching, any change in the baby's behavior. But the bottom line is, anytime you have a feeling that something is wrong, we want you to listen to that and report that. One of the things that we are learning more about that is obviously a very difficult thing to measure, but maternal instinct is alive and well. It's a very real thing. And we want moms to trust themselves and to feel empowered to advocate for their babies, because that maternal intuition is a very real thing. And so even if you have this gut feeling and none of these actual symptoms, I still want you to go in, because that is a symptom, even if it doesn't show up in a lot of the materials. So trust your instincts. You are the only person that can be your baby's voice. And so don't hesitate to do that. One of my favorite quotes from one of our researchers, who is also a midwife and a stillbirth mother, her comment is, "You're not being a bother, you're being a mother." And so when you feel like something is wrong with your baby, and this is true all through the pregnancy, and it's also true when they're an infant or a toddler, moms have a special connection with their children. And so if you feel like something is wrong, we want you to take them in. Another provider that I work with a lot says, "We would rather see you 1,000 times and tell you 1,000 times that everything is looking great and you did the right thing by checking in on us, rather than the one time that you don't come in and something might actually be wrong." So don't ever hesitate to come in. You're doing your job as a mom by doing that. And that's what we want you to do, is start parenting this baby right from the beginning. All right, I think that's all I have. As Anna mentioned, Star Legacy is here to provide education, but also support. If you have had a loss or are experiencing loss, know someone who has, we would be more than willing to try to reach out and offer any support and services that we can. Any additional information about preventing some of these deaths and how to improve your chances of a safe pregnancy, definitely reach out. We're more than happy to be here for us. And with any questions, we're happy to do that as well. I have the privilege now of turning it over to Nancy to talk a little bit about her work with SIDS.
Thank you so much, Lindsay. That was an excellent presentation. And now I'm going to make Nancy co-host so she can go ahead and share about her work.
There we go. Okay. All these pop-ups that are coming up and I can't get to my clicker here. All right. Okay. Thank you so much, Anna. Thank you, Lindsay. And just like both Anna and Lindsay, I am a lost mom. And my son died from SIDS many years ago. And we know so much more today than we did back then. So actually, it's much more proactive than reactive. And because we know so much more. So, I like to talk about safe sleep for baby. And sometimes it's really hard. We hear, oh, safe sleep for baby is so easy. And sometimes it's hard. If you've got, who knows, if you have other children, if you had a hard day, if the baby's fussy. So we're going to work on doing the best we can to provide safe sleep for your baby. This is my contact information if you want to take a screenshot. Whether you have more information on safe sleep, tummy time, or anything like that, or if, God forbid, you have a loss, so you can reach me, okay? Excuse me, why safe sleep for baby? Well, unfortunately, in the United States, Illinois has one of the highest infant mortality rates. We are 36 out of 50 for infant mortality, which is infant death in the United States, and that is terrible. So our program, we try to meet the Healthy People Goal 2020 of 6 infant deaths per 1,000 live births. In Illinois, right around now, we're about between 6.2 and 6.4 infant deaths per 1,000 live births. But we do have some counties in our state where their death rate is 13 deaths per 1,000 live births. So we still have a lot of work to do. So this is Julia Rose, and Julia Rose is a safe sleeper. As you can see, she's sleeping alone. She's on her back, and she's in a safe crib. So she has a swaddle wrap on her. She's wearing a wearable blanket with a swaddle on it, and Julia does not like to have her arms put in restricted. So she doesn't mind being swaddled around her torso, but she likes to have her arms free because then she can do what, she can, that's just how she likes it. She's sleeping on a firm mattress that has a very tightly fitted sheet. As a matter of fact, this is the Cribette, and this is from Cribs for Kids, their program, and that's who we buy them from. They're very similar to a Pack and Play, but I like them better. And they also have the safe sleep message on it. So that's always good for somebody who's watching your baby. Julia sleeps flat on her back. So from the day she was born, she was placed on her back to sleep. And actually, we recommend that the American Academy of Pediatrics recommends that we do safe sleep for baby 360. I don't know if you can see that, 365. And that means for the very first year of life, we're going to place baby down on their backs to sleep for every sleep, nighttime or nap time. Now, when baby is, 4, 5, 6 months old, they start rolling and they start, practicing trying to roll to their tummy. So the first time that they roll to their tummy, if you're there, you can turn them back. But for those of you who already had children, you know that once they're competent at rolling back and forth, you could stand there all night and flip that child. And if they want to sleep on their belly, that's how they're going to sleep. But we're always going to put them down on their backs to sleep, okay? And one of the ways that we can help facilitate that is by doing tummy time. So what tummy time is going to start right from birth. Oh, I've got another slide in a minute that I'll show you, and we'll go into more detail. As you can see, Julia has actually what she's wearing is just a long sleeve t-shirt and a diaper. So it is a wearable blanket. It's not pajamas. So this helps keep her at a very good temperature. And there is nothing in the crib with her. It's the crib, the mattress, the sheet, the baby, and a wearable blanket. And then if the baby likes a pacifier. So Not all babies like a pacifier. Research has shown that it does help to reduce the risk of SIDS, but it doesn't prevent it. So if baby doesn't like a pacifier, please don't force them to take it. We want to make sure that baby doesn't get overheated. So I think in the Midwest, we're pretty good. When it's warm, we put our kids in a t-shirt and a diaper and, everything's good. But as soon as the temperature hits like, 45, 40 degrees, we dress them like they're going to the North Pole. They got long sleeve t-shirt on. They've got big fuzzy socks on. Then they've got a warm up, like a velour outfit, a jacket. They got a cap. Then we put them in the car seat. And we put a car seat cover on it, and then we get our babies just way too hot. Babies only need the same amount of layers that you're wearing, plus maybe one thin layer for sleep, okay, which is where the wearable blanket comes into play. Hats are fine when you're outside. Of course, it's chilly, it's cold. You want some kind of a knit hat or something on the baby. This is they're facing their head. It's like their thermostat. And so if baby gets overheated or when they're ill, this is where all the temperature is going to escape to the top of their head and their face. So if we have baby's head covered while they're indoors and they get overheated, just like us, when we get really hot, you get sleepy and just kind of, lethargic, and that can happen to babies too, and we don't want them to do that. In the summer, it's okay to put a bonnet on the baby when you go outside because, of course, we don't want baby to get a sunburn, so that's fine. But when you're in the house, please do not have a cap on the baby. Unfortunately, every single outfit that they sell today just about comes with a cap. And so, if your great Aunt Edna gave it to you, that outfit, dress the baby in it, put the cap on her, take her picture, and then take the hat off, okay? Because we don't want to have the baby get overheated. So Julia is going to sleep in her parents' room for the first 12 months of life. Actually, she is coming up. She's about 9 months old right now. So they have moved her to a full-size regular crib. But the recommendation from the American Academy of Pediatrics is to keep the baby in your room, but not in your bed, okay? Sometimes it's really easy, just like baby's cranky, you're cranky, to bring the baby to bed with you. And it's okay for, playtime and feeding and lovey time. But when you and your partner, and especially baby, are tired or start to get sleepy, you need to put them back in their own safe sleep area, okay? One of the things that I tell new moms, especially if they're going to breastfeed, which of course we recommend, but fed is best. So whether you choose formula or breast milk, as long as your baby is getting fed, that's what we want. But if you're bringing the baby to bed to feed, for any mother who's breastfed, as the hormones release, it like is anesthetic for mom. The baby latches on, your milk comes down, and you're sleeping because you're so tired. So one of the things I recommend to moms is to get their smartphone and set the alarm on it to go off like every 5 minutes, okay? Because then if they do fall asleep, their alarm will go off and they'll be, okay, oh, baby's sleeping, she's done, I burped her, she's clean, let's put her back in her safe sleep area. That way, it's less of a chance that you would accidentally roll over on her. And I know many, many women who say, I would never roll over on my baby. And unfortunately, we have like almost an entire support group of moms who accidentally, or dads who accidentally rolled over on their baby. Because remember, when you're sleeping, you're not aware of what's going on. And tiny babies, especially babies under like 12 weeks, they cannot compete in that arena. They don't move enough to like wake you up necessarily, nor will they, if you're covering them up, you might not feel them struggling or gasping or crying because you're in such a sound sleep. So better safe than sorry, keep baby next to you. Now, having the crib or let's say the cribette in your room with you is excellent. I would say you need to keep it about 12 inches away from your bed, okay? Because when baby starts to roll, if she rolls towards where you are and your mattress is right up against the mesh on the cribette, now baby's got her face right up against your mattress. That could be a suffocation hazard. So we want to make sure that we push that, cribette a little ways away, at least 12 inches, so that we don't have to worry about that being a problem, okay? And like I said before, we do recommend that babies are breastfed, but, as long as your baby's getting fed, that is the best thing. That's the thing we want to make sure that you understand. that don't let people make you feel badly, or don't, if they start preaching at you, because fed is best. One thing I want to mention about formula is that it's really important to follow the directions exactly on the can, unless you use the pre-made that is just ready to drink, but that's pretty expensive. So, a lot of moms use powdered formula. So, if you start running low because it's like getting close to the end of the month and you're running low on formula, please do not dilute. Please do not dilute your formula, because what happens is then the baby's not getting the correct nutrition, okay? And then also they're getting too much water. And so that is not good for the baby. That the formula is meant to have, just so much liquid. So if you are running low on, it's getting close and you just don't think you're going to make it till your next WIC appointment, call some of the social service agencies around you and see if they can help you, because a lot of them, do have the ability, they can help you at least get some temporarily, okay? And finally, we want to make sure that baby is sleeping in a smoke-free environment. So that means, like if you're a smoker, and I'm a recovering smoker, I was smoking. Then when I got pregnant with my son, I quit smoking, started smoking again the day he died, and quit smoking for good March 7th, 1987, when I found out I was pregnant with my first daughter. And so, I do miss it, but I'm not going to start smoking again. But the smoke when secondhand smoke, of course, is passive. And when you have baby near you and you're smoking, the baby's, inhaling all those toxins. But then you also have to think about third-hand smoke. So, now say I had a cigarette and my clothes are stinky, my hair is stinky, my face is stinky, and now I put baby up like this. Well, that's also passive smoking. And so now baby's exposed to those toxins still. So, the best thing is to not smoke at all. Okay, that's the truth. But if, it is dose dependent. So if you can cut down as much as you can, that helps. Okay. And the thing we're concerned about is the nicotine, because the nicotine kind of like dulls the senses. And if you and your partner are smokers, and especially if you have the baby, like you bring her to bed to feed, you don't arouse as easily. So it's the nicotine that we're concerned about. Okay. So trying to keep baby as smoke-free as possible. So I had mentioned earlier that we don't want you to bed share with your baby. The very first picture is me as a brand new mom. That was my son that died, but he didn't die then. I was smart enough not to put him on the inside of the sofa, but not smart enough to keep him, to have him at all on the couch to sleep. He was born in June, and I have him dressed again like he's going to the North Pole. And we didn't even have air conditioning in our house, so I don't know what I was thinking. The second picture is something that can be purchased, but a couple things about it. It has a positioner in it, and the American Academy of Pediatrics says no positioners for baby when they're sleeping. And actually, that nester is only about maybe 6 inches high, and it is really easy to flip your pillow over there, pull the covers up, and then baby could suffocate. I do laugh at this picture. It's the ad that's on the packaging. And I would really like to meet somebody who can sleep all night with the covers at their hips and with their hands, like that, sleeping all night. I just think that's hilarious. And then the third picture, darling picture, looks like baby brother with his newborn sibling. It's a cute picture, but it's a really dangerous picture. And when people see stuff like that in the media, they go, "Oh, it might be safe because they have it on, this magazine or on that TV show, whatever." Remember I said before, babies need to sleep all by themselves. So even though this is a cute picture, it's a bad message. And it's one of those things that we really kind of cringe at when we see it. I don't ever want to make anybody feel badly. I just also don't want them to give the wrong impression. So there are only 3 places that are safe for your baby to sleep. The first one is a crib. It's a full-size crib, like the wooden ones you get. It has to be, of course, no drop sides. Those are all against the law. And it has to be manufactured after December 28th of 2011. If it was built before then, it doesn't meet the current safety standards, okay? And we're not going to have bumpers. We're not going to have quilts or pillows or stuffed animals or nothing. Remember, the crib, the mattress, the sheet, the baby. That's it. The second thing that's safe for your baby to sleep in is a pack and play or portable play yard or the cribette, because that meets all the safety standards. But again, it must be built after February 28th of 2013. If somebody says, oh yeah, my kid's, 12 years old, I still got his pack and play in the basement, let me give it to you. No, not good. It doesn't meet the current safety standards. So at that point, either use it for a catch-all, or if they will let you, take a box cutter to it. Because if you throw it out in the trash, just like with an old crib, somebody's going to go, ah, who's throwing away this perfectly good crib? And then, it could be a danger and an accident could happen. The third thing that's safe for a baby to sleep in is a bassinet, but it must be labeled as a bassinet. I know Up a Baby has in their travel system has a bassinet, and that is safe for a baby to sleep in. And you can see that picture. That is a bassinet, and that is safe. Again, it has to be manufactured after April 23rd of 2014. But things like a DockATot or some of these other, in-bed sleepers are extremely dangerous, and we've had a number of deaths with that. Again, you don't get a do-over if something happens. And so, my job is to give you the best evidence-based research, peer-reviewed information that we have available so that you can make the choice that's best for you and your family. So let's talk a minute about tummy time. So these babies are clearly very good at tummy time. Tummy time starts the day the baby's born. A lot of moms and dads think, well, when their belly button falls off. No, too late. You need to start right away. So, you start slow. It's like, 30, 60 seconds at a time, 2 or 3 times a day. By the time baby's about 3 months old, they're up to about 60 minutes a day of tummy time, but it's not all at once. Not like, okay, it is 7:30 and you've got till 8:30 and then I can put you back in a different position. No, it's a couple minutes here, a couple minutes there. And it's not just on their belly. It's when you hold them up on your shoulder, they have to work really hard, to hold their head up. You could hold them in a football hold where their tummy is on your arm and they have to look up. So babies only need to be asleep. Babies only need to be on their backs when they're sleeping. When they're awake, we want to hold them and love them and, play with them. Also, don't overuse those handled carriers that are sometimes a car seat. Those are not comfortable for baby, and you might be changing location, but you're not changing the baby's position. And think about if you've been ill and you've been in bed for a while, how much your tailbone hurts and your heels hurt from laying in bed so much. Babies can feel like that too. I do have some really good handouts for tummy time. So, you shoot me an email, nancy@sidsillinois.org, and I'll be happy to share those with you. Also, all of our information comes in English and Spanish, and I do have a Polish speaker. So if you need information in Polish, I can help you with that too. So a healthy baby is a happy baby. When you have a happy baby, you have a happy mom and dad too, okay? I want to just quickly go over a couple things that are not safe. Just because they sell it doesn't mean it's safe. When I was a new mom, I thought, wow, they wouldn't sell it if it wasn't safe. No, not true. As long as they can, you can think of it, manufacture it, advertise it, make it, sell it, until there are either terrible accidents or multiple deaths. It's really tough to get some of this stuff off the market. But we work really hard at that, and we complain about everything. So I have the Consumer Product Safety Commission on speed dial on my phone because I'm such a tattletale. I'm always reporting people for unsafe products. A really good resource for you would be to sign up for recalls.plural.gov, and you can choose what you want to get notified of. So I get anywhere from, sometimes I get 1 a week, sometimes I might get 4 or 5, and they're all related to infants and children. You can pick what you want or what you're most interested in. But it's really good because then you don't have to rely on, I didn't see it in the paper, or I didn't hear it on the news. That's really important. Car seats should never be used for sleeping. So the baby on the right is, the car is moving. And as long as the car is moving and the car seat is installed correctly, your baby's going to be fine. And if they fall asleep, that's fine. What we're talking about is using a car seat for a sleeping device. That is not okay, because anytime the baby's chin is on their chest, now we've kind of obstructed their airway a little bit, okay? So it's fine if baby falls asleep while the baby's in the car and the car is going and the car seat's built properly, but don't use it, just regular for a sleeping area. Hopefully you've heard the news about this rocker sleeper, and it's Fisher Price, Graco, a whole bunch of them have been recalled. If you have anything at all that looks anything like this, destroy it. And please do not put your baby in it to sleep. We've just seen the numbers just keep rising. And then we also have tip over deaths. So make sure that any furniture you have that's heavy like this, especially, dressers with drawers, kids will pull them out and they start to climb on them. You want to make sure it's anchored to the wall very well. And you can prevent injuries and deaths by, just making sure you have anything that's heavy that the kid could tip over, that you keep it attached. So the ABCs of safe sleep: alone, on the back, in a safe crib, in a smoke-free environment. So if you think of the ABCs: alone, on back, in a safe crib, in a smoke-free environment, that's the major information about safe sleep for baby. We want to keep all of our babies safe. So we're going to do everything we can, first through the, getting pregnant and during the pregnancy, all the things that you learned from Anna and from Lindsay. And then once the baby's born, all the things that we could do to help keep our babies safe. And this is our contact information. We have an 800 number. Our office is located in Lisle, but we cover the entire state of Illinois. And again, if you have a question or problem, don't hesitate to reach out. My email is Nancy, Nancy, at SIDS, Illinois, all spelled out, .org. You can see it at the bottom. So thank you so much. I really appreciate your time and listening. I know that this isn't always a pleasant thing to talk about, but I hope that, you feel like it's proactive and that you do have a lot of control over this.
Thank you so much, Nancy, and thanks to Lindsay from afar as well. She did have to jump off of our presentation here, but I think that the information that has been presented today is very valuable and absolutely just essential to the well-being of our babies. And I think, all three of us, we did go on to have additional children. And so in our pregnancies and in our baby's infancy, we were hyper cautious with everything, right? And it was interesting to me, like even listening, even though I distribute your materials to my families, I'm sorry, not my families, to families, through the diaper packages, like some of the things you talked about tonight, I was like, oh, wow, I did that wrong. So just, goes to show you that there's always more learning to be done. And that's doesn't matter how well educated you are or how many babies you've had. You also pointed out how things are constantly changing. We have expiration dates for a reason, and things before a certain date, don't use them anymore. So I think this will hopefully be a very valuable presentation for lots of folks to watch and organizations to use to share with their expecting or new moms and dads and families, caregivers, everything, right? I was just talking to Lindsay about, I'm not sure that something of this nature has been done before, right? Like a kind of multi-layered, different.
I don't think so, not with these topics. I mean,
right.
I've participated in a lot of presentations, and this is the first one like this, and I'm thrilled that you invited me. So thank you very much.
Oh, absolutely. I am so glad and honored that you both were able to join me on this presentation. As you know, I was going to do it all on my own at first, but there's no way I could have presented the information to the level of detail that both you and Lindsay were able to tonight. So I very much appreciate your participation. I look forward to our future work together. And I also want to just check out this Facebook Live real quick. And Eddie, I know you're still on the call here, so maybe.
Oh, absolutely. See if anybody has any questions.
Yes.
But again, just to reiterate, Nancy, thank you so much for all the information you have given. I'm extremely grateful and appreciative of your time. and for the education you provided. I definitely look forward to collaborating with any future presentations and events. So thank you so much, Nancy.
Thank you.
And also to Lindsay as well from Star Legacy Foundation. Thank you.
And Eddie, thank you so much. All this happened because of you. With your involvement with me and Gifts from Liam, starting the Diaper Depot and wanting to host this, before your diaper donation toy drive wraps up.
Absolutely.
I see that we have a number of viewers on
Yes, at one point,
live
absolutely.
event right now. This is the first time, everyone, that I'm doing a Zoom/Facebook Live thing. So I'm struggling to actually
You're
get
doing great,
back
Anna. Thank you so
to the
much. You're
live.
doing great.
Thank you, Eddie. Thank you. I don't know why I can't see the Facebook Live right now to see if anybody watching us has any questions. Maybe it's
Now
because
we could always circle
open.
back and
I don't know.
comment below.
Can you see Eddie?
Mhm.
I mean, Eddie, can you see like if anyone has commented with any questions or anything like that? Can you check on that?
I think just a few people were just sharing the support of the live videos, but I don't see any additional questions.
Okay, well, that is totally fine. People will be able to replay this as needed. Again, I think it's super valuable information, and I just want to reiterate how all of the information that we're sharing tonight is evidence-based, peer-reviewed. We're not talking old wives' tales here. Everything that we're talking about is scientific knowledge that is going to help you, whether you're a mom, a dad, a grandma, grandpa, auntie, uncle, caregiver, whoever you are, whatever you may be to a baby. Everything we talked about tonight will help you in keeping your babies safe and healthy.
Thank you.
Anything to add, Nancy or Eddie, before we end this tonight?
No, if anybody has any questions, I'm so happy to talk to you, and you don't only have to be in Illinois. I talk to anybody, whether you're in Illinois or not.
Yes, likewise. I know all of us, Nancy, myself, and Lindsay, being lost moms, as well as moms who have also gone through subsequent healthy pregnancies with happy outcomes.
Right.
We're very much all on board with talking to anyone out there who needs support, assistance, questions, anything like that. And I'm very happy to know these ladies as partners and as friends and as support.
Okay, well, thank you
and
so
Eddie,
much for inviting
thank you.
me.
I have to again give a shout out to Eddie. Thank you again so much for this collaboration, for getting this going. If it wasn't for you, pushing me to do this, it wouldn't happen. So this is absolutely all credit given to you for making this happen. And then also extra super special thanks to you and Jackie for having our first diaper depot. And I'm so excited that you guys have already received 600 plus diaper donations. That's gonna really help us out.
Absolutely. Thank you so much, Anna. And again, Nancy, Lindsay, everybody to make this happen. This is wonderful. And like, again, we want to just, we feel it'll be extra special to collaborate in the future. So thank you everybody for tuning in. Okay. This is great. Thank you so much, Anna. Everybody have a wonderful evening. We'll stay in touch.
Thank you too. Okay.
And happy holidays, everyone.
Okay. Bye-bye.
Absolutely.
Bye-bye.
Thank you.